TIF, transoral incisionless fundoplication, is a different way to do the same type of procedure that they've been doing since really 1935 is when Nissen was first described. And what it is it's taking the top of the stomach and it's wrapping it as a cuff around the bottom of the esophagus to provide pressure to the end of the esophagus, which closes it. The difference is we can now do this without incisions. We go through the mouth, we fold the stomach up. It looks just exactly like a Nissen fundoplication. It performs like a Nissen fundoplication, but it does not cause the side effects. So proton pump inhibitors came out in the 1980s, and by the early 1990s there were trials comparing laparoscopic Nissen fundoplication to PPIs. And what they found is that the Nissen fundoplication was actually better at controlling reflux than the PPIs, but it also had a lot of side effects. Trouble swallowing, gassiness, bloating that couldn't be explained and that we didn't have a treatment for. So the recommendation was to only use those surgeries in the most severe circumstances, and they sort of fell out of favor. And of course, PPI therapy basically became the mainstay of treatment, to the point where most doctors that treat reflux primarily would not recommend a surgery, even if things became pretty severe. When TIF came out in 2007 and through its initial development through 2009, what we discovered is we were able to control reflux at a very high rate, but none of the side effects, none of the bloating, none of the gassiness. As a matter of fact, in some of these trials, it showed a negative correlation. The bloating and gassiness improved when they had a TIF type fundoplication. So over time, we have studied the safety aspects as well and found that TIF is about 6 times safer than a Nissen fundoplication, and it's reproducible. So one of the arguments against Nissen as well was very few surgeons could copy the technique and come up with a good wrap every single time. With the evolution of the device and the training that's going on in the last 10 years, that has become a very reproducible valve. The device is more automated now, and so the valve that you create looks the same every single time. Where before, sometimes you would get a good valve, sometimes you wouldn't. Now it's very reproducible. We get the same valve pretty much every time.